So if your body feels, your brain, your body, you feel burnt out, you don't need to name that more than just burnout. Like you don't have to say, I have adrenal burnout. Your adrenals are actually just smartly, they're intelligently listening to the brain saying, pause, please.
Like it's the end of year. There's a lot of stress being built up over the year. And, during the holiday season, there's even more stress because there may be family functions and work functions and all these things that you need to commit to. And you may be like a working mama, or you're trying to conceive and running to a clinic, or you have parents that you need to take care of, and all simultaneously, it's all melded together. So there's talk about adrenal fatigue, and there's myths around it. We need to talk about this, and also what can we do about it? So Tanya, why don't you start off and share your thoughts around this?
Yeah, I think it helps to sometimes understand, like I always say, name it, blame it, tame it. I really think it's important to understand what's going on with you. And sometimes it helps to have a name so that you can really, address it full head on. So adrenal fatigue is a name that naturopathic doctors have often used because we're trying to help patients understand that they're not burnt out and exhausted because, there's something bigger or going on with them. This is after we've ruled everything out. And really what's going on is that when a person is showing these symptoms of I feel like the biggest thing is overwhelm. And then with that comes exhaustion and then lack of motivation. And they're I just don't know where to start. And I'm so burnt out. And they'll ask, because they've read about it, they'll say, I want to check my cortisol levels. And maybe their cortisol levels are low, but they're not functionally low to the point where they have a condition called Addison. So medical doctors will think, oh, you naturopathic nuts, like the ones who don't understand what we do. You're calling this condition adrenal fatigue. My patient doesn't have adrenal fatigue. And so I want patients to understand that really what they're experiencing is adrenal breaks. Like the adrenals are saying, you know what? I'm going to take a break from releasing cortisol. So if you're seeing low cortisol, for example, it's possible that they've had lots of stress recently. Like as you just kind of listed a few things, it could be that they've had recent losses, or they're going through perimenopause transition, or they're trying to make babies. And it's high stress, constant, that high cortisol, because adrenal glands, these little glands that sit on top of the kidneys, they are magical and they produce cortisol. So it gets us going in the morning and gets us working and up for the day and excited to go. But if it's constantly being produced at a level that's, unhealthy, you start to feel heart palpitations and anxiety. The brain says, you know what, that's too much cortisol. We need to now protect our brain, because high cortisol constant, if we let that go, the brain would actually be negatively impacted by the continuous production of the cortisol, in addition to our heart. That's why we say stress can be harmful if it's too much, too long. And so the body has a natural wiring to say, you know what, you need a break. And sometimes that's okay, a virus is going to hit you and you're forced and you're pinned to your bed with a cold. Or it could just be you're just tired and you don't understand why. And you see a naturopathic doctor and you've ruled everything out, and maybe you were fighting a virus and it just accentuated it, but it's also possible that you're just experiencing brain burnout. Now, the classic treatment by a medical doctor in this kind of scenario potentially could be, an anti-anxiety medication short-term, or an antidepressant. It's not that those aren't effective. In fact, they are often very effective. The problem and concern is more that they might become now part of the person's life long term. And we haven't looked at all the strategies and lifestyle medicine and acupuncture and natural solutions that could get you out of that situation nicely without now being dependent on a medication, which can, some of them do come with side effects. So I don't take it lightly. I mean, if I'm recommending somebody need an antidepressant medication because they're burnt out, and we've exhausted other measures, then absolutely it makes sense. So I'm not poo-pooing at all the use of antidepressants. It's just that it's like the top 10 prescription. And I think we need to look at this differently and, help patients figure out ways to balance their lives. It's just in medical school, this is not taught. So I'll stop rambling on, but
no. This is so important. I just want to add in exactly, I just want to slow it down for 1 second, because you said it's one of the top 10 prescribed drugs. So,
I think so. I should double check on that, but I feel like it is, because at least in my office, it's
it's true.
Come in.
Now, so the reason why I think it's important is because we need to look at, because both Dr. Tanya Wild and myself, we don't subscribe and say just one way or another. We do believe in integrative medicine. So there is a time and place for everything. So yes, absolutely. If acupuncture alone can do it, fantastic. If, lifestyle dietary changes can do it, and exercise, fantastic. But what happens when, you're in this juncture of time, a period of your life, there's just so much overwhelm and you can't even function. It's like, well, you know what? We need to get extra ammunition. And this is a time where you can go through the medical doctor, and perhaps taking the medication is actually the best way forward. And we're not subscribing to, let's have you on it indefinitely for life, because no one really goes in wanting to do that. And listen, some people may need that, right? But that's not for us. And it's not within our scope of practice anyway to say yay or nay. But that said, for those that are always looking for, what can I do naturally? Well, if all the natural stuff is helping, absolutely keep it going. Well, I mean, whether you do the the medical drugs or not, we should actually look at our lifestyle, hands down. But that said, if it's not enough, and don't feel guilty or bad or wrong or sad and about and just embrace that, at this moment, I'm going to surrender to some extra help with some medication. That's it.
Yeah. And sometimes, and especially certain medications, like the antidepressants that work on dopamine upregulation, can get your energy up and motivation back to be able to then do the lifestyle changes that can help with this feeling of burnout. And then you can wean off of those medications.
Through your doctor. Through your doctor. Correct. Not alone.
Because we don't have the scope to prescribe it. We don't have the scope to take you off of those medications. So the adrenal glands are these little glands. They sit on top of the kidneys and they produce DHEA and cortisol and, noradrenaline and adrenaline. The brain produces dopamine. So those last three are like, catecholamines, and they are produced in response to stress. So if your body feels, your brain, your body, you feel burnt out, you don't need to name that more than just burnout. Like, you don't have to say, I have adrenal burnout. Your adrenals are actually just smartly, they're intelligently listening to the brain saying, pause, please. And so I think what we need to do is just kind of go inward when we're feeling like that and reach out for help to say, okay, you know what can I do to help me get out of this situation? So whether it be naturopathic, conventional, or combined. And I think that as medical doctors, if a patient kind of goes into you and says, my naturopathic doctor, not me, because I don't call it that, but back in my earlier days, I did. So until I realized, and I changed I now recognize it's not a thing. Although I always said it was, it's a very, I always said, I explained to patients, you don't have Addison's disease, which is where your adrenal glands have completely been wiped out and are no longer producing the hormones and catecholamines. It's more just that you're in a burnout situation. And, I would say that your adrenals are taking a pause, but it's like, there's no such thing as adrenal fatigue where I don't want patients to be concerned that their adrenals aren't functioning. They're actually just pausing, which is a good thing.
Okay. So can we now then go straight into, well, if we're not going to do meds to start with, maybe we can completely avoid it altogether. So what are the top tips that we want to provide today so that people can listen to this and walk away going, yes, okay, we got this.
Yes. So number one, eat. So if you're one of these people who kind of like rushes through the day just to get through and you have no time to eat, you're going to feel tired all the time. So eat regularly, and protein. Make sure you're getting protein at your meals and vegetables. So it's really easy to say, I have no time, and then grab a quick donut or a muffin and then feel really tired because of that. The adrenal glands are part of the whole endocrine system, and they're very linked to the rest of the endocrine organs, including or glands, including the pancreas and the insulin pathway. So like stress will definitely impact that, and what you're eating matters.
Yes.
So food matters for sure. Number 2, find ways to build in breaks. And sometimes that means, if you don't know how to relax, involve a treatment that you really enjoy or you have seen really big benefit perhaps in your life before, like massage therapy and acupuncture. And in Chinese medicine, as you know, Mary, when you're recirculating energy to your kidney organs and spleen, which is like in traditional Chinese medicines, like the spleen is in charge of, transforming and transporting foods and fluids. And if you are on the go constantly, you're not absorbing foods properly. So if you use acupuncture and traditional Chinese medicine herbs to target the spleen, stomach, and the liver and the kidneys, then you can actually learn to relax. And I'm sure you've seen people.
So if I might add in,
Mm-hmm.
so it's like, yes, 100%. The spleen is such an important organ in Chinese medicine because we say that we get our acquired essence, our energy, our fuel from that. So we need it to be working properly because we want to be able to transform the food that you take in so that we can transport all of the energy throughout our body so that we can be vital and energetic and go along our way and without being stressed. So that said, the acupuncture can also decrease and mitigate that stress response. So you're talking about that, cortisol being constantly going. How I equate it to if we drive a car is, we are more efficient at saving gas when we don't have the gas when we put our foot on the gas and the brakes at the same time. But that's what happens when our cortisol is like, it's like we're revved up like permanently. So it's like, let's take the gas off and let's take the foot off the brakes. And now you'll actually coast so much better. And there's less energetic drawing from our body. And, that is very helpful, and acupuncture can help to do this. So you're going to comment and add something?
Yeah, I was going to say it's like a tired wired. Patients will often feel like they're tired, but they're so wired that they can't sleep. So one really important thing to do is cut back the caffeine, whether the caffeine is coming through coffee or tea or chocolate.
Yes.
So if you're finding yourself skipping meals and turning to more coffee just to get the energy up, and then with that coffee comes some dessert, which will later give you a bit of a crash, you recognize this. Like, just look out to see if you're doing that and start taking away the coffee and the desserty things that are, picking you up quickly, but then giving you like the sustained low fatigue feeling.
And if you refuse to stop it, at least do it at a time that's way earlier in the day so it doesn't impede your sleep at night.
Yes, exactly. Because if you can get a restorative sleep, then you have the ability to relax, and then you can like build in these little tools that we're talking about so that, eventually you'll kind of wake up without the alarm clock and hitting the snooze button over and over again.
Which is that point then too, because you're talking, we were talking about the points to help with this. So sleep is one of them. So, food is one of them, and not just what you eat actually to eat, and then what you eat matters. When you eat matters, when you drink matters. And then what's next? So there's sleep, and what else?
And then, so sleep, nutrition, and then use up your cortisol. We are a society known for not moving enough. So in order to use up the high cortisol that often comes before the low cortisol, so we often have too much. And then eventually, if you did a morning blood cortisol, it'll show low. So in that phase where you're running high, perhaps from, stimulants and drinking coffee, or you're just go, 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 and you're feeling on top of the world until you're like no longer there. You want to make sure in being on top of the world, you want to make sure you're exercising as well, because then you can use up that cortisol and have deep restorative sleeps. Exercise is something that will help you use up those fight, flight, freeze hormones, the catecholamines.
This is brilliant. And I'm just thinking about my dog. Okay. So for anyone who has a dog that is active, not the dogs that don't like to move, but I have Honey, who is this Labradoodle, and she needs to get her zoomies out. Anyone with a dog will understand this. So I'm seeing this as the same thing. Right?
Oh, yeah. We are animals. We are wired like animals for sure. So that's so cute. So she's got zoomies. What time does she have zoomies? Is it multiple times a day?
It can be multiple times a day, but and if she doesn't get it out, then she'll actually be not the nicest dog, right? So we have she'll be agitated and moves too much and starts barking because she wants more attention. So it's that's not that different as a human being. We need to move, get things going. Otherwise, we can get a little bit grumpier, right?
Right. So before burnout often is that grumpy agitation and anxiety. So to get rid of the feelings of anxiety and the zoomies, go work out. Find something that you love. It could just be going for a 20-minute walk after meals to help you use your nutrition, like your sugars, more effectively, and get rid of just that stagnant, stuck feeling of just sitting at work all day long. And it's really especially important for patients or people who are working long hours. And this time of year is often associated with end of year budgets and billings, and not just, the day-to-day stuff. So it's really important to build in that time so that you can enjoy your holidays, because if you come to the holidays and you've been overdoing it, it might be you're on the couch the whole time with COVID that's going around again, or the flu, the seasonal flu, the influenza, or RSV.
So,
and then, sorry.
No, I was just going to add in, when you say exercise, and we're not necessarily saying the traditional exercise, because you're 100% right. Didn't I last week have a guy come in and he says, "Oh my gosh, Mary, I'm literally staying at work and doing work till 11 at night. So there's no time. I haven't even had time to go to the gym and exercise." It's okay, well, knowing that you can't go to the gym, or knowing that you can't do these, very specific workouts, what can you do? Can you get up and do a lap around your house for a second, right? And just take that little moment of breather, because it's not just resetting the body, it also helps to reset the mind. So it's this, I think it's a myth when people think that they can sit for 11, 12 hours straight and focus. That's actually humanly impossible. It's
you're building an inefficiency.
Yeah.
So set yourself up for success. Build an efficiency, take the breaks, and then you'll spend less time at your desk doing the work. Because I think what happens is you just tap out, you're wandering, maybe you're looking at Google, and you're giving yourself a mental break. You're forced into it. You can't produce at that pace. I mean, maybe there are times, but it's not day in, day out. So you build in time where okay, I have to, maybe you're working not from home and you're going to work. So build in that time on the way back to add a gym workout. Don't go home. If you go home, you're not going to do it. Or perhaps first thing in the morning, get it out of the way, check it off the list, right? So find a time that is going to work for you. And so this is part of my visits with patients is when are you going to make the time? And let's commit to it. Be accountable to somebody, because exercise is a prescription. It can add 10 years of good quality life. That's what Dr. Peter Attia says, I trust him.
Yes.
He has, done his research. And so that's usually I think it's 3 to 4 days of, good intensity exercise, and then strength training. If you don't have the energy because you're in burnout mode, forget it. Just don't do the cardio. Go to the gym or do really light weights with a video like hasfit.com. It's free. Lots of free stuff on the internet right now where you can follow along with videos, and, you can get weights, one set of dumbbells for this holiday season, depending on what you're celebrating. If you celebrate Christmas, ask for it, or whatever it is. You can make the time for yourself to use up that cortisol. It is worth it. Then you can focus and be more efficient and not feel paralyzed by anxiety or burnt out, exhausted.
So
And then
if I can add in like a very quick tip with a quick tips regarding this, it's like, okay, you have to work long hours and you are actually commuting. So if you're taking a bus, can we take a bus like and stop earlier and walk? Or, you know, instead of taking the escalator, can you run up the stairs? Or if you're driving, park a little further than what you normally would so that there is a little built-in walk. So it doesn't look like extra work, but, you know, for A and B, but at least there's more movement in. And I myself, like on a Wednesday, I'll go up to work and I have to be there by 7 and I still have to do a whole whack of things prior. So sometimes if I don't have enough time, what I'll do is I get to work at least 15 minutes earlier and I actually do a workout there. And who cares if I'm in my regular clothes, working clothes? I don't care. I'm moving.
Yeah. And then you also give yourself the permission to have downtime where you also do strength training, right? Like you give yourself that time, like the separate away from the daily activity living of walking to work, or do you make the time?
Are you the day that I'm like, okay, so on the Wednesdays, I literally go full on like 7 in the morning till like 8 at night. So are we talking, do I take a lunch break?
Outside of those days. No, not lunch break. I just mean strength training. You will do
100%.
Yes.
Yeah. My goal is to do 5 days, if not 7.
Right.
Not just strength, like, but I alternate it, right? So I'll have my toning strength days, and then I'll have my days with more like yoga, more relaxing stretching days. Yeah, for sure, 100%.
So
and if you're going to do one or the other, and I forget who was it that said this, it's like if you're going to, actually when we interviewed Dr. Lauren King, who is an exercise fitness person who was a former Argonaut person. Anyway, he was saying that if you're going to just look at exercise, what's more important, aerobic or strength training? Which one is it going to be? Can you guys guess? All right. We just created that pause. We created that pause, and now you can answer it.
So this strength training, his answer was strength training, right?
Yeah. 100%.
And you can hear all about his answers around that in the new year. We'll release his podcast because he gave us some really juicy info to help us like get in shape and tips and tricks.
For a nice booty.
For a nice booty. That's right. Tips and tricks for a nice booty. I think it's really important to recognize that, you know, people who are type A, getting it all in work-wise, in order to keep going, there has to be a point where you say, I need to build in something more than just those walks on the way to the train. There has to be carved out time for you. Otherwise, even that's not enough. You may reach a burnout place, and you have to enjoy your time away from work and doing, like, just build in strength training. Make that some of your happy time, because then you're using up cortisol and you won't burn out and you won't feel anxious. So I value exercise so much, and I feel like it's not prescribed enough. It needs to be a prescription, right?
Yes, yes, 100%. Now, I'm going to ask you a very, like a private question, but I'm sure it's not so private because we talk about a lot of things.
Yeah.
So, postpartum, like, when did you start exercising? Like, we need to give ourselves permission to like chill. Like, how long do you wait before you start the full on exercise? Or is it not full on? Do we gradually do this?
I think it depends on the person, but we say for sure wait 6 weeks before you even think about like anything like, weight training and cardio. But I know there's a lot of celebrities who will start around then to be back into their bodies and have their awesome shape back. They hire trainers and chefs. And then if you're the average person, you're looking at making sure, I would say, around 3 months, but you can start walking at around the 6-week mark. And then for me personally, I started back at the gym at the postpartum 3-month mark because I need it for mental health and sleep and energy. I feel like my energy is way higher and focus if I have the workouts in there. But it wasn't like I went back every day. It was like kickboxing a couple times per week. And then walking on the other days, and then gradually building back in strength training. But more than postpartum, even viruses will knock you down, or if you get injured, you have to take time. There's going to be times where you're not going to be working out. It's more just, let's be proactive to not get adrenal breaks that are too big, too long, or exhaustion, burnout. Mary, how about you? When did you start working out postpartum?
Well, unlike you, I didn't have a plan like that at all. And I'm going to be super honest. Full working out and with true regimen was after Zoe was 3 years old. But you have to also understand that I was very crazy because when she was a toddler, every night in the middle of the night, I was writing my book. Pathways to Pregnancy. So it was full on. And for some reason, I didn't feel burnt out, but yet at the same time, and she was a kid that never slept fully till she was 5. So I chose sleep over full on exercise because at that juncture of time, it was so super important. I needed to thrive and I needed sleep.
Yeah.
Now, that said, in the middle of the night, every night, what did I do when I was waiting for her to fall back asleep? I actually did yoga.
Nice.
Every night. But while she was doing, because, when there's lack of sleep, you just feel tighter. And so I had to do that. And that's how I have to help myself to keep going. But so everyone's different is basically the answer.
Yeah. Yeah, for sure. So, and then last, before we go, I would love to give a couple recommendations for herbs, things to consider we call them adaptogenic herbs. They're not, or adrenal herbs, but they're not really, they actually operate more on your brain. So they're brain herbs that act as adaptogens. So if you're tired and wired, they help you kind of feel calmer and energized. So my favorites are rhodiola and ashwagandha, which is Indian ginseng. And then there are others, Siberian ginseng, Panax ginseng is contraindicated if you have high blood pressure. That's why I like the former two ginsengs. Licorice in some women is helpful, but it's contraindicated in high blood pressure as well. Some of them are too stimulating and can cause heart palpitations. So you definitely want to speak with your healthcare provider, your naturopathic doctor, to find one that works for you. And so it's not that you would just jump on herbs and say, okay, that's my solution. I'm just going to take these herbs and I'm going to be all better. You would do it in conjunction with nutrition and lifestyle changes. But again, if you're trying to avoid conventional meds and you're trying to use something more natural, this might be like a kind of transitional point where you use these herbs so that you have a little more energy so that you can then start to, and sleep better so that you can start to do the lifestyle changes.
That's awesome. And then, of course, to add in, I need to add this in about acupuncture because we do know that it helps with cortisol and balancing the parasympathetic and sympathetic nervous systems so that to keep you calm and keep you vital and energized. So hope that was helpful for you guys. Please DM us at Alive Holistic Health Clinic on Instagram, and you can reach out to us. We can speak to you directly and book an appointment with us.
Stay tuned for our next episode where we will talk about mood changes and how the connection between dopamine and estrogen, and how if you are somebody who is susceptible to depression and anxiety, how perimenopause may be a place where you need extra help and why.